David Modell, and Barney Arnold. So we're all here. We're now legal. The agenda for tonight is at 7 p.m. We'll have community input. At 7:05, the LEPC update. 7:15, discussion of cable licensing process and the announcement of January 5th public information session. 7:45, a Board of Health request for the fiscal 22 budget for the public health nurse. So actually, there'll be some earlier requests as well for the remainder of this fiscal year. 8:15, execute Lowell Street easement documents. 8:30, appointments. 8:35, cemetery deeds. 8:40, the town administrator's report. 8:50, liaison reports. 9 o'clock, approval of minutes and warrants. And 9:05, we will attempt to adjourn. Some of these may be taken out of order, as always, if we're running either ahead or behind schedule. So let me start with community input. Is there any community input this evening? I'll have to call up the participants here. I don't see any hands raised. So I guess not. All right. Let's move on then to the LEPC report. Chief Fisher.
Good evening, all. I have some mixed news. I think we'll probably talk about a little more serious news first. Unfortunately, the cases have really sharply increased in the town of Carlisle. Linda Fantasia ran the numbers for me right before the meeting tonight, just so our numbers are the most current. So I'd like to thank Linda for doing that. She's been diligent about keeping us all informed, of course, of the numbers. I think the significant ones, and that she felt were significant, the cases for December, both probable and confirmed, are 37. Our running total is 96 as of 12/21. So as of today, probable and confirmed 96. And then the last 14 days, which is the look back that many use, we have 29. And our median age, they range from 2 to 82, but our median age is 37. So that's the unfortunate piece of news. So I think that from an LEPC front, I think those on the LEPC, those working in the vaccination subcommittees, and we really ask, I think this is a public ask for citizens of Carlisle to remain diligent, especially during the holiday season with gatherings, because we're in a tough spot right now, and we really don't want it to get any worse. Now, the upside is the Carlisle Fire Department has been diligently providing residents from 6 categories the opportunity for tests. So you can get testing right here in Carlisle for those that fit, and it's most folks. But you can please check the town website, or the Mosquito was very good about publishing that. I was in town hall late this afternoon, and I think they were already up to 40 bookings for tomorrow. So our firefighters have really done a phenomenal job with the testing. I think the high so far was, I think there a day or two ago, and that was 60 residents were tested. Residents, staff members, and staff members were tested. So that's the balance. We're fortunate that the fire department has grabbed this. The vaccine subcommittee has been working diligently to provide LEPC guidance and Board of Health guidance about our ability to do the vaccine. I think we're at a really good spot. It's taken a lot of planning, a lot of hours from members of Board of Health, doctors and nurses that are volunteering on that group. But we're actively pursuing, when we get to the vaccine, for Carlisle residents, the Congregational Church has generously offered their back parking lot as a spot. The vaccine subcommittee visited there. We feel strongly that's probably the best spot for a variety of reasons. It's flat. It's going to be very easy for those that have any kind of movement issues to be able to get in and out. It's It's pretty clear. It's in the center of town. Importantly, there are restroom facilities for the volunteers and the staff that are working the vaccine when it comes to Carlisle. Speaking of the vaccine, Carlisle has joined Concord in application for the first responders. Those applications were due tomorrow. I know that a lot of them have already been filed. We provided our numbers right away. As soon as we learned at 6:30 last Thursday night that that was going to be the request from the state to for municipalities to either provide the plan to have their first responders vaccinated or to join others. I don't want to spill the thunder until we meet tomorrow. The Concord Carlisle group is scheduled to meet tomorrow at 2 p.m. But I've already gotten calls from some other municipalities that would like to join, and I believe some of them are going to be joining our call tomorrow. So I think that regionally we have a good plan for the first responders, which will probably be the first wave that maybe need to be vaccinated locally. Other local happenings, the Carlisle Cheer Group has done a fantastic job keeping people's spirits up. So our LEPC group is super appreciative of that. Had some really nice events last weekend. So there are some other LEPC members here, and Linda Fantasia is on this call. So if anybody else wants to raise up something, I think I would ask them to do that now at this point, because otherwise that's my report. It's kind of the highlights of the week, Mr. Lewis.
Thank you. Anybody else from the LAPC want to make any comments?
Yeah, Alan, just one other statistic. It turns out that 42% of the COVID clusters are from households. So not restaurants, gyms, other activities. They're happening in the home.
Yeah, and I think it's important to say, a lot of these came right after Thanksgiving, due to travel, and we really need to take the admonition seriously that if you don't need to travel, please don't. I know this is a wonderful time of year to go and see family and to socialize, but things are getting worse. They're not getting better. And if you can possibly prevent further spread, please do so. If you can stay home, stay home. And let's not make things any worse than they are. I did hear that something over 80% of ICU beds in Massachusetts are now occupied. We don't need to make that any worse. 100% in California are occupied. So we need to be responsible, and this really is. This is up to individuals to take responsibility for how we handle this. So please do that. And I know it's a difficult time, but this is serious. Anybody else?
I would call Mr. Goddard. Are you going to cover the CARES Act extension in your report?
I intended to. If you want to address it here.
No,
okay,
because you've done a fantastic job of keeping us all informed and doing all the hard work on the CARES Act funding. So I just want to make sure that piece of information got passed along. So thank you in advance for that. And I think I'll take my leave unless anybody has any other questions.
Oh, thank you, Chief. And let me commend Chief Fisher as the emergency management director of this town. Has been putting in enormous amounts of time and effort, and his leadership has been absolutely essential to the wonderful planning that's gone on in Carlisle. As you may know, Carlisle has really been ahead of the curve during much of this entire pandemic, and much of that is due to his efforts. So thank you, Chief.
Thank you very much.
Yeah. All right. It's almost 7:15, so I think we can move on, if they're here, to the cable licensing process.
Mr. Chairman, we're joined tonight by Sue Buskey of the Buskey Group of Sacramento, California, who are our consultants for the cable licensing process. And Town Council Jenny Merrill and I have been working with Sue for a few weeks now. And I wanted to have her come to this meeting, both to meet the select board and also to preview the January 5th public informational meeting that is planned for both an overview of the licensing process, but also an opportunity for residents to air any issues or concerns that they have. And I know they have many because we've heard them for a long time with respect to Comcast. But with that, Mr. Chairman, I'll introduce Sue, and she can introduce herself.
Thank you and welcome.
Thank you. Good evening. I'm pleased to be here with you tonight. I've been really lucky over the last 10 years or so to work with a number of Massachusetts communities, assisting them with the cable license / franchise renewal process. And so I'm just really pleased to be able to help you all. What I'm going to do on January 5th, and that's kind of what I thought I would share with you tonight, and then answer any questions you have in advance. Okay. Is I'm going to go over what is a franchise, and I say franchise, but in sort of more broad terms. In Massachusetts, we call it a license agreement. It is more broadly termed a franchise agreement. Okay, they're one and the same for our purposes of conversation. So if you see me using those terms interchangeably, they can be used interchangeably. So that's the first thing. Basically, the franchise or license renewal process is an opportunity for communities to revisit the, in most cases, 10-year agreement where they have with their incumbent cable operator. Now, in some communities, it's one operator like Comcast or Charter or RCN or whatever. In other communities, it's two companies like Comcast or Verizon. In your community, it's one. Your license agreement expires in October of 2021, so it's coming up really quickly. The federal law and state process for franchise renewal is actually a 3-year process. So Mr. Goddard and I and the city attorney have already talked about the need to probably go to and get an extension of the current license agreement to make sure there's adequate time to prepare for and enter and complete the negotiation process. It's not something that necessarily is quick and easy. For most people like yourselves, it's not something you deal with except for maybe once every 10 years, okay? For me, I deal with it all the time and have been dealing with it for the last 30 plus years. So it's what I do. So part of what we do in the license and franchise renewal process is, first of all, I'll be doing on January 5th, is giving you a little bit more detail on what is the process under federal law and state law. What are the opportunities that franchise or license renewals present to the community? Let me give you a little hint on that one. Just think about how much your use of technology has changed in 10 years. Because it was 10 years ago, essentially, this franchise agreement was negotiated. It's day and night. Okay, now think about that. License agreement was 10 years before that. So when you look at the license renewal process, you're really looking at an opportunity to update your communications planning process, because like it or not, the cable system delivers not only cable service, but internet and telephone. Okay, now technically we can't touch the internet and telephone, but at the end of the day, it all runs on the same wire. So we need to look at the license renewal process as a part of an overall communications planning process, which is why public input, or what we call needs assessment, is so important. And that's the part of the renewal process that I get involved in with many communities. And that is running a public input process, or what we call needs assessment. So we'll be talking more about that process, what the benefits are of that process, what we will be doing as part of that that needs assessment process, and all of that will be provided with PowerPoint at your January 5th meeting. We'll also be there to answer your questions, to answer any other public questions. Just to be clear, this is technically not a public hearing, okay? It will be run like you run your normal public meeting process, where you allow, as appropriate, public input, questions, whatever. So I just want to make that real clear, because this is not intended to be a public hearing. It's intended to be an informational meeting where you guys get information, find out what this thing's all about, how long it's going to take roughly, and what's happened in other communities as a result of these sort of franchise or license renewal process. The key thing to remember is the license or franchise that will be renewed will likely be another 10-year agreement. So what you will be doing in this process is setting the stage for the next 10 years for Carlisle with regard to community programming, city council meeting coverage, the ability for folks in the community who can't get cable right now because they have really long lanes and the line extension policy in your current license agreement is rather dated, okay? All of those things will be things that we'll be touching on as we go through this, this process of this public needs assessment process. So with that, I'll stop and find out what questions you all may have for me, and then things that you want to make sure from your perspective I cover on January 5th.
Open it up for anybody to ask questions.
Sue, could you mention, so this first meeting on January 5th is really to explain what the process is going to be. And just for our benefit going forward, just briefly, how many other opportunities will there be for community residents to weigh in?
There could be quite a number. And I'll, in short, number one, there's going to be a series of what we call stakeholder meetings that will have to be held via Zoom because of COVID. Normally they would be in person, etc. And there will be 3 of those. And then in addition, there will be an online survey. So people will have the ability to participate in these Zoom stakeholder meetings and or to participate in the online survey.
Thank you. I guess the other one question many people have is we essentially have a sole source in this town. And so the question is, what sort of negotiation, what kind of a negotiating position do we have?
Well, and frankly, in most places in the country, there's only one cable operator. So you're not unusual, okay?
All right.
Really, the opportunity to negotiate is actually based on doing the process laid out in federal law properly, okay? And that involves, and I'll dive into it more next time, 2 things. Determine whether the company has complied with the terms and conditions of the existing license agreement. Have they complied with their contract, okay? And number 2, finding out what our community cable related needs and interests, and in particular future community cable related needs and interests. And that's the needs assessment process. If you do those things properly and not shortcut them, all right, you are then positioned based on state and federal law to enter the negotiating process and to be able to require things. And there's sort of 2 parts of the renewal process. One is what we call an informal process, which is negotiations. The other is called a formal process, which is the formal issuance of what we call an RFRP, a request for renewal proposal. It rarely gets to the RFRP process because folks can usually get to yes, so to speak, through negotiations. But you know, I know it feels like, well, there's only one company and there's not going to nobody else is probably going to come in. So what is the negotiation? Negotiation is really effectively using the procedures and processes that are laid out for us in state and federal law to represent the needs of our community and to assure the community that the company has complied with the terms and obligations under its current agreement.
Thank you. Does
Yeah, my question is related to Mr. Lewis's, which is, I don't get all that. I mean, it's sole source, so they could tell us to go pound sand. I mean, they're gonna say it in a nice way, but they're gonna tell us to go stuff it. They're just gonna give us what they give us.
Well,
I don't understand this process at all. If there's no other source, there's no negotiation. Like, we have no leverage.
yes, because you can tell them
What are
no.
we gonna say? No?
You have the right to tell
What
them
happens if, all
no.
right, let's explore that. What happens if they tell them no? What happens if?
Well,
they
because
don't?
they don't want you to tell them no. And when at the end of the day, they are going to agree. I mean, I can give you numerous examples in Massachusetts, as for example, where there's one operator. A good one is Cambridge, as an example, but it's a larger city. I understand that completely. But we did the renewal process in Cambridge about 10 years ago, or actually 8 years ago, they're in renewal again. And what came out of that renewal process was based on the fact that the city very thoroughly did the public input process. And when the company said, no, we won't do it, we just simply said, look at federal law and look at what our public input says. And oh, by the way, you haven't complied with your current license agreement in these 3 areas, for example. Okay, therefore, they become tools in your negotiating tool belt. So I know.
Let me ask, Sue, you're you're kind of giving me classic negotiation strategy, like if there's a real negotiation. But I'm not accepting that there's a real negotiation. So let me ask you, well, let me.
I can tell you there is. Okay, I haven't done this for 40 years. I can kind of tell you there is. Okay.
Sue, first of all, have they not, if they've not complied, or if we should think they've not complied, that's research we could be doing now, correct?
I am going to be working with Jenny and Tim on that
So,
process, yes.
so we should have that inbound. But
You
mean, I'm,
cut out there a
you
moment, sir.
know, reflect, feedback. And everybody hates, everybody hates their cable company. That's been since AT&T disbanded in, 40 years ago. Like, so I get it. Nobody likes that. But if we don't have realistic choices, I mean, if a Cambridge came back with a bunch of stuff, can we go say, well, we want what Cambridge got? I mean, why go to all this work?
You can say, look what Cambridge got, look what their public input said, look what our public input says. It says very similar things. We should get what they got.
All right. So why wouldn't it's Comcast, right? Why wouldn't they know this, right? Why wouldn't they just offer this package based on that experience to the towns? Do they really want a negotiation with every single town?
Oh, they don't want it, but they have to have it because that's state law.
But I mean, if they already know,
I mean, I can tell.
If they already know they've given Cambridge X, why wouldn't they just offer X? Like, why go through the shit?
Because they're going to say, well, you guys are different. And here's an example. You don't do a very thorough, say, performance review, just as an example. Okay. You don't, and technically they haven't complied with certain aspects of their franchise agreement. Okay. If you don't do that performance review, or if you don't get that input from the public, you can't say to them, listen, these are things under federal law. We have the right to require certain things and negotiate for certain things. All right. We have done our due diligence. We are now, this is what we're going to be talking about. That's why that's why it's a 3-year process under federal law. It's not intended to be kind of rubber stampy. I mean, frankly, you guys are lucky in Massachusetts because there are over 25 states around the country where the states pulled away the authority of local governments to even negotiate these agreements, put it at the state level, and issued these one size fits all agreements. Whether you're, to give you an example, and for Massachusetts, it would be whether you're Carlisle or Boston, it doesn't matter. It's just a state franchise. It's exactly the same. Well, that's what's happened in 20 some other states. And I will tell you the result of that has been that the quality of cable service has declined in those states with state franchising because there is no local back and forth.
Let me ask one other question. Is there, if we do let's say we conclude all this and we do a new 10-year agreement, is there anything that keeps Verizon from coming in 4 years from now and saying we want to also offer service?
Nothing at all.
Okay.
In fact, I've worked in communities like Malden and many others where you've got a Comcast franchise that expires and Verizon's expires 4 years later. So so in other words, they're not all in you. It's better in the perfect world to have them all expiring if you have more than one at the same time. But there's nothing that prevents Verizon from coming in at any time.
Okay, so the fact that we negotiate a 10-year agreement with Comcast doesn't preclude Verizon coming in 5 years from now and saying we want to also offer service. Okay.
That is correct. Yes.
Thank you. Okay.
What are examples, Sue, of things we could get that we don't have now?
Well, and I'll give you a couple of things. It's my understanding that there are people who would want cable service in your community, but can't get it because of the length of line that goes down their lane or road. And cable company won't come and deliver service to that without charging them a lot of money. That's what we call the line extension policy. Mm-hmm. The line extension policy in your franchise is pretty dated. I think if it's aerial plant, it's 30 or 40 units per mile, or the equivalent of 30, 40 units, dwelling units, or I'll call it units because it could be a business, not just a dwelling unit. Okay. per mile. I've seen 10 units per mile in newer franchises. So that's kind of one example of something that could come out of this renewal process. That could be, from what I understand from Mr. Goddard, something that would be of interest to folks in the community.
Okay.
There are other things
That's
like
the kind
that.
of example where, right, so that's an example where maybe it wouldn't bubble to the top of Cambridge's list, but it would be ours.
Exactly.
All right. So, all right, so we're gonna solicit this input for people and kind of come up with a wish list.
There will be an extensive report that's issued that it'll lay out what the data is that was gathered, what the findings are, and what the recommendations are. Then it'll be up to your negotiating team to set forth to negotiate the agreement. And then there are times when we provide assistance to the negotiating team as they're negotiating. In some cases, we actually do negotiations, but that's not part of our role right now with the community. It's doing the needs assessment, getting you to the data, support what you negotiate for.
So you're paid by us just to be a neutral third party, like an advocate, or
Yes.
you have a stake in?
My job is to make sure,
And-
again, I'm paid by you, not the cable company, okay? Yes, my job is to make sure that you are armed as well as you can be armed, forgive the term, okay? With the data and information you need to support what should be in that new license agreement.
And then when that license agreement is made, is that then a standard pricing? So let's say we want this last mile, kind of thing where you've got the people have to have wires or cables or whatever to their house. And the cable company says, well, great, we'll do that, but everybody's going to pay, $3 a month more. Is that the way it would work? Or
No, it would not
Not clear
automatically
on-
mean everybody pays more, no.
Tim, can you remind me, have we ever approached this renewal negotiation armed with this kind of data before?
Well, the first one was when I was starting with Carlisle, they were wrapping it up. So I really can't speak to the process. There was a cable advisory committee that was very involved at the time. The town had special counsel. We're using town counsel now. I was not involved in the negotiations 10 years ago.
I'm just wondering if at the very least, this would signal to the, Comcast people that we're serious and we want to be sure that we get the best deal that we can. Then it might be, so.
Yeah.
Still.
If I might answer that question, the answer to your question is, Kate, is yes. It sends a signal that the company just can't come in and try to roll over you guys.
Exactly. Right.
Sue, you said at the beginning that you were recommending that we extend our current agreement because there wasn't enough time between now and October to get this assessment done. So how long do you think we need to have for that assessment period to be done appropriately?
Well, we will be done with the needs assessment process itself and ready to hand the data over by the middle of July, but then all the negotiations have to happen after that. And typically a negotiating process is going to take at least a year because you can't do it full time. I mean, maybe you have a meeting or once a month to negotiate. Well, they take, 10, 12 meetings, 2 hours each before you actually get to an agreement. So what I've suggested is that town council go ahead and get the agreement to extend the license agreement for a year. That just gives you some extra time. And if you need to extend it more beyond that, you can, as have some places, but I just suggested a year as a practical matter.
Hey, any other questions? All right. Thank you very much. Looking forward to working with you.
Looking forward to seeing you
Thank
all
you, Sue.
again and working with you. See you on January 5th.
See you on January
Thank you.
5th. Yeah.
Bye, guys.
Thank you.
Enjoy your
Sue.
daylight.
Bye-bye.
Bye.
Thank you.
So Alan, so January 5th, she's saying it's not a public hearing. So are we holding a special select board meeting? Is that what's happening? I mean, an additional select board meeting from what we would normally have?
I don't think it's a select board meeting. It's going to be a public information session held by them.
Okay.
Yeah.
Okay.
So
Got it.
yeah.
And we've signed a contract with Sue Busk to provide this service.
Yes, and
Yeah,
all that
yes.
information has been sent to us. It's all been, you have it somewhere in your emails of
Okay.
who all the principals are in the group and all that sort of thing.
Yeah,
Yeah.
okay.
And, okay, so, and Tim, you'll send us a notice of when that's going to be in on the 5th. I already just put it in my calendar because I'll want to
Right.
come, but.
Yeah.
Yeah.
I'm assuming it's going to be an evening session of some sort.
Yeah,
Yeah, it'll be a Tuesday evening. The board's next meeting is January 12th, so this would be
Right.
the
Right.
Tuesday prior, when we don't
Okay.
have a meeting scheduled.
And Tim, how is this going to get publicized since the mosquito's not publishing again until after the meeting date?
oh, that's a good question.
Well, I'll take that up with them. Maybe they can help us out with
Yeah, they may be
a
able to do a news blast.
informational
Yeah.
blast of some sort. Yeah.
And
Maybe
I
it's
I
on.
think it'd be helpful for, I mean, I'm assuming we want people to come to it so they understand that this is an opportunity
Yeah.
to improve service.
Right.
Yeah. And it's
Yeah.
been a hot topic on City in the Woods. We can certainly disseminate it
Yeah.
through them. Yeah.
Yeah, and we probably should use some of the other networks, right?
Right.
Like the COA and the RecCom list, and
Right.
have Jen post something on the town website,
Yep.
et cetera. Yeah.
Okay.
But as a result of that, is Sue going to then promulgate a survey, or what is the work product that gets the in?
Yeah, she did say there at some place during this process, there'll be a public survey done.
That they'll
And, then
run?
and she
That's
said
it.
these forums, these stakeholder forums.
Stakeholder meeting.
Three forums and a survey.
Okay.
Yeah.
That they'll administer that?
Yes.
Okay, thank you.
All right. Anything else on this topic? If not, if Linda or whoever's going to present for the Board of Health is ready to go, we can do that. Are you there? Tony, I think you are. Yes.
Yeah. Yeah.
It's magic how you pop up on the screen. All right. The floor is yours, Tony Marinaro.
Well, thank you. Thanks, Chairman and all members of the board for having us on your agenda tonight. I have a PowerPoint if that's helpful to guide through this, through a little summary of what we're presenting to you guys, or
Sure, go right ahead.
I can just speak to it, whatever you feel is best.
If you prefer this PowerPoint, go. Yep, we can give you the screen.
Okay, sure. Let me see if I can do that.
Be able to go ahead.
I have to figure out how to do that. So screen here. No, that doesn't work.
Kate, while he's doing that, so how did you change your name on your screen here?
I went in, oh God, how did I?
David appears to have done it as well.
Sure.
Yeah, you, so go to the little icon that has your, up in the upper right in your little box, there's a 3 dots,
Yeah,
and right click on that. Right click on that, or click on that,
Click on
and
it.
there's a rename function.
Mhm. Yep.
So Tony, do you have the share? Do you see the share screen at the bottom?
Yeah, I do. I think I've got it. Hang on.
Okay.
So I want to go to this one.
There you go.
There we are. You're up.
Okay, great. Thanks. I'm a bit of a rookie at sharing screen.
Welcome to the crowd.
So what we wanted to present was our our planning for fiscal year 22 for the positions in the Department of Health, and so the idea is that we need to increase some of the hours that we have just to be able to perform the duties that the state mandates, to do what we need to do to operate as a health department in the state of Massachusetts. What we're proposing is to create a part-time public health nurse position. As you probably are aware, we've had a grant that's provided us with some partial coverage for that in the past, over the past year or two, and that's been pretty successful. But we really see the need to create an actual position. We don't know about getting the grants, and the grants don't quite cover the scope of the services that we're going to need from a public health nurse, and I'll get into that in a few minutes. We also want to increase the hours for the assistant to the health agent position. Tonight, we'll just do a little review of this and entertain any questions you have, and we're really looking to gain your support so when we can go to FinCom with this in January and get this taken care of. Let's see. So we're proposing to add a public health nurse, and we looking for a position of 10 hours a week. So as I mentioned, it existed as a successful grant-funded program for the past couple of fiscal years, and well, actually 19 and 20, and then there have been reasons, as we all know, in 21 that have kept us from actually being able to perform some of the things that we have under that grant, being limited by COVID for public gatherings, as well as just the time for the nurse that we have doesn't allow, because of COVID duties, doesn't allow to cover the scope of what we've done in the past years.
And what was that scope, Tony? So everyone's aware of that? The things that haven't been able to be done?
Yeah, I'll go through that. I've got another
Okay.
slide that kind of details all the things that the public health nurse needs to do. Just a moment.
Okay, sorry. Yep.
Let's see. So we're also looking for, well, we do have a budget that covers about an hour a month, and that's really for some very minor things that we need as far as planning the flu clinics. We have a very small amount of money for that. Anyway, we need an increase. I'll get into what we need from that in a minute. We are also looking for an increase for the public for the assistant health agent, and from a current 24 hours a week to a 35-hour per week position. So that would be split between the operating account, and that's an increase from 9 to 17.5 hours a week. And then the currently under the 53E account, covered through our fees, it's 15 hours increased up to 17.5 hours. These changes, as I say, are to provide, the depth of breadth of skilled services needed for the health department duties. It's not to look for to cover clerical duties and things like that, but things that can only be done by either a public health nurse or a trained and certified and having certain certifications assistant to the health agent. We want to emphasize these aren't about COVID. This was all needed pre-COVID. COVID has exacerbated the whole thing, where the board and our entire department is really out straight, and we're lucky to have the public health nurse we have at this point through Emerson Home Care, and managing a lot of our contact tracing and the COVID issues. We are so, and again, it's not about clerical type services. So the public health nurse, there are a number of things that I'm sure you're familiar with, many of them, but I could run through, just list them And a lot of there's a lot more information in the handout that that Kathy and Linda had put together, and Kathy had sent on to Tim, and hopefully you guys have had a chance to look at that before the meeting, but this is touching on some of that information. So one of the things that they would do is oversee and follow up on diseases reported in Maven and surveillance, the state surveillance system. They would be able to reduce 911 calls through medical consults and family support and mental health emergencies. Support EMS so that there's timely consultation to avoid unnecessary resident transports to hospitals. That's we view as a potential use of the public health nurse that could save town funds with EMS responses. So in a large part, the public health nurse would be supporting the local health needs, the flu clinics, the senior flu clinics we have, and we expect that flu and other vaccine clinics are going to increase even after we have COVID under control. So consultation and educational outreach, Ask a Nurse, blood pressure clinics, these types of things that were performed under the grant that we had. Resource for animal exposure bites, health agent and animal inspector. I mean, I'll try to run through these a little quicker and you'll get the gist of it. Resource for local emergency planning committee and disaster emergency prep. Liaison to Medical Reserve Corps, the MRC, to assist with volunteers, training and events, communications to volunteers and community members. So a lot of these things kind of hit home right now because we're going through it with the COVID issues, but this is the sort of thing that we need in place, just around year round, COVID or no COVID. We envisioned that the public health nurse under their duties would be able to support the school and recreation department and camps. So health department resource for school administration and school nurses. This is currently going on. There are, as I hear, there's a lot of times when the school nurses will consult our public health nurse and to just maybe get some direction and some guidance on a few things. So this is an important duty as well. Inspectional activities, camp compliance with Mass State Sanitary Code, verify camp health records, immunizations, provide support for camper illnesses. So it's general community type of things fit in as well. Hang on, let's see. All right, so some of the driving forces for this and the needs that we have is growing responsibility for state regulations and increased complexity of the regulations. We've got expansion of work, new growth, and aging of the town. So we have, I mean, there's a number of things for the health assistant, health agent assistant that would be able to be covered by more input by the health assistant. So higher number and more complex water and septic arrangements. This has been going on for quite some time. More system failures and limited remediation options. So some of these things may just kind of go in one ear and out the other, and we can discuss some of the details of these things. But for example, that particular one, it's not just large failures that I think are obvious, like the Benfield system, but just certainly in Zone A, we have a lot of issues when people want to do any kind of building. All of a sudden, that triggers the Title V, and there's non-compliant systems that have to be taken care of, and that triggers that action. And the postage stamp lots in a lot of the Zone A properties are very difficult to get systems put in, and a lot of the innovative technologies have to be used to be able to fit in to these areas. And so this requires a heck of a lot more work by the health department and just trying to implement the state regulations around these different types of systems. So more monitoring and compliance to state and special permit conditions. This is associated with these innovative and alternative technologies, and also some of the larger developments in town that have gone in over the past 10 years and continue to go in, including we're looking toward Woodward development as one of these. So there's quite a bit more monitoring and compliance monitoring for those that take up staff time. More public health demands for the foreseeable future. We're dealing with all kinds of things with, as people have probably heard, with the beavers, tick and mosquito-borne illnesses, some of the clinics, event licensing, collateral damage from the pandemic, just things that have come up because of it that have to be addressed by the health department. Adequate staff for rapid response and full coverage, including during staff vacations, absences, and for succession needs. This is a real concern of ours. The health really have to have someone at a health agent capacity at all times, and some of the state programs we're in require that, and they actually do monitor that we have the proper backup, so that if there's some sort of state emergency that requires Carlisle to participate, to be able to stay in these programs, we have to have that resource. There are certain training and certifications required for that we want to be able to meet with the health agent's assistant, so that if the health agent is not available at the time, that we can cover and stay in these programs. So implementation of electronic communications or record-keeping systems, which are going to be beneficial and make things more efficient, but they're going to require more time. So this is something that we're looking at across all the land use departments, and we see that as really being important to make things efficient, but it's going to require more time of the health department to actually, ramp up on this stuff. And so that's another thing that will be needed. That's probably, not more than once that type of thing is implemented, it's not going to be a long-term need, but it's certainly a current need. So here are the numbers that we're looking at. So the assistant to the health agent. So we're looking at the added costs to the operating account of $18,945 and 53. So to the fees being $5,572. For the public health nurse, obviously not covered by fees, so it's $16,269. So the total, once you back out the current public health nurse, the total change to the tax base is $34,594. We did a little looking and looked at how Board of Health increase in the budget over time has compared with some of the other town departments. And as you can see from this graph, the green triangle line is the Board of Health. And although it started lower than some for reasons that are legitimate, some departments may have more costs and less fee-based. The increase as the town has grown is close to flat, and really has not kept up. If you see the red line being Conscom, which also started low and also has fee-based funding, they have increased, quite a bit with the growth of the town and as needed. So we're looking at that and thinking we really, this is not a huge increase we're looking for, but we really think it's necessary. And this kind of shows that we need to stay up with the changing town as a health department and provide the services as the town develops. So what's the alternatives if we don't move ahead with this? It can get expensive in other ways. So a reactive approach is always more costly to things, and emergency response definitely would suffer. We just wouldn't have, the capacity to deal with any kind of emergency response issues that we would if we had the increase, especially with the public health nurse. But also part of that is the assistant position. So, a big thing, as I mentioned, is the guarantee of continuity of operations. So, having a succession plan for the health agent, as well as covering when the health agent is unavailable. Ability to work collaboratively with other departments would be compromised. This is another thing that we're dealing with in town, trying to, especially land use departments. Certainly it goes on with public safety. And as we're all seeing now, the cooperation between the Department of Health and the different public safety entities in town is much needed at this time. But this is also for land use as well. We're really trying to coordinate land use so it's more streamlined. It's more successful program for the residents of town and the developers that work in town. So we lose ability to get grant funded projects if we don't have the proper qualifications as far as the assistant position and the public health nurse. And also we lose capacity to apply for grants. It takes time, and this is something that would really be helped by having those extra hours. So we wouldn't really be addressing the backlog of state mandated work. So, I mean, Linda can give you some examples of that as we further discuss this, but there's a number of things that the state requires that aren't high priority, but start to pile up just because we don't have the capacity to handle them. So understaffing hinders the ability to improve operations. Understaffing hurts timeliness of state mandated land use and public health services. Excessive workload is a stressor that may lead to poor staff health, sick time, and higher healthcare premiums. That's a real thing, and we really want to make sure that our staff is working efficiently. And when certainly during COVID, we've seen an overworked staff, but we feel that this to really provide the services that the health department has to for town, we need to get more hours to give the staff a little bit more normal working hours instead of all of this extra time they've put in. So the members of the Board of Health have done a lot recently at taking up tasks that would normally be handled by the department staff. And, we understand it's a COVID time, but this was happening before COVID hit us. Ever since I joined the board, it seemed to have ramped up quite a bit. And a lot of that has to do with growth of the town as far as not necessarily population, but the developments in town. And they're more complex. There's different things happening as far as those developments go. There's an increase in public water supply wells, large combined septic systems, and some of the innovative approaches to those systems that have showed some struggles in complying. And so there's been a lot of work to kind of support the health staff and get things done in a timely manner. So we keep the development moving forward. If we can increase the assistant hours for that, I think that would alleviate a lot of things. Also, I know Kathy Galligan, as our treasurer, has been doing a lot of work with on the financial side of things that would typically be able to be handled by the department staff, but they are really on some real high priority tasks at this time, and so we don't think this is sustainable. I mean, board members can't put in the hours that we have. we have day jobs as well. And so this what we feel is somewhat of a modest increase to the health agent assistant would really alleviate a lot of that. It would eliminate, without it, eliminate popular programs that mean communication and trusting relationships with the community members. I guess what we mean by that is, some of these programs that the department sets up, increase our presence in the community. So when there are crises, the town is familiar with the health department and trusting of the health department. And so we think that's an important aspect of the select board to endorse the proposed level of resources for fiscal year 22. And we are prepared to go to, with your endorsement, to FinCom, and they've been abreast of what we're trying to do. We've kept them up to date, and we would go to them in January and hopefully move this forward. So yeah, thanks for letting me present that. And, I'm sure you have plenty of questions, and I think Kathy, as our treasurer, has a lot of insight here, and of course Linda, as our health agent, can help with these questions too.
Thank you, Tony. Questions from the board? Well, I have one. A year ago, the Board of Health came actually with a proposal which actually reduced the assistant's hours with the idea that higher pay and more competency would be handled that. And not with, certainly with COVID, we understand all the pressures that has done. But again, your presentation says this is not COVID related. This is stuff that's to be going on an ongoing basis in fiscal 22. And I guess my question would be, what has changed in that year that changes your justification that you made a year ago?
I'll take that one.
Okay.
So that was kind of controversial last year within the health department members. I was back on the board for about 6 months at that point. I think most everyone knows that I had been on the board for maybe 7 years, went off for 3 years, maybe, came back on. And so last year, we absolutely needed to have 2 deep health agent capability. That had to be accomplished. There was also pressure about keeping taxes under control. So the departments were really given the strong message that they should come in with very modest increases, if any. So I felt that we could put together this, the higher level position, and we could improve efficiencies within the department. And Linda tried to warn me. Linda was absolutely not in favor of this, but I prevailed, and I feel like I made a deal with the devil in, having everyone agree with me. I didn't realize 6 months back on the board just how much had changed. My tenure on the board goes back 10 years. And when I left the board, innovative alternative systems were still fairly rare and fairly new. And Benfield when I left the board, Benfield the septic system hadn't yet been signed off and approved. And so I came back on thinking that things were pretty much the way they were. And I was just flat out wrong. And so when I proposed that, we could go down to 9 hours we went from 2 assistants, which were more of a clerical support nature, to a higher level assistant to the health agent, with the idea that that person could get the credentials and the skill set needed to be a backup agent as needed. And Tony alluded to how much work he and I came we came on the board at the same time a year and a half ago. And I have just been flabbergasted by how much research I'm doing to try to come up to speed on state regulations, on different types of septic systems, on different types of public health problems, like PFAS in water. We were recently asked if we could go after a grant for that. And that's where a public health nurse would come in, actually. But I just didn't have a good handle on how much the health department's work had changed. And that's really what it comes down to.
Thanks, Kathy. I thought I better ask that question because I know the Board of Finance will.
Yeah, that's a really good question. Yeah. And so, when Tony had the slides, and I think you should have all gotten the memo that we prepared, when we talk about the complexity of both the systems and the regulations, the other thing that we had never seen or rarely seen before, people are stacking innovative alternative systems. So it goes through one, the waste coming out of the house goes through one innovative alternative system, and then it goes out to the field where there's another IA system. The other thing that we ran into for the first time ever, twice in 1 month, we had single family residences come before us to have a stack up of the single family residence, an accessory apartment, and a guest house on one lot. And it's like, oh my God, so I was reading Title V, trying to get my mind around how do you even think about this? How do the regulations apply in a situation like this? So we're seeing new things. And, I spoke to the person that originally developed the accessory apartment bylaw and asked, how did you envision when this would happen? And his answer was, honestly, we could never have even conceived of that. But that's the sort of thing that we're having happen.
Okay, thank you. Any questions from the other members?
Yeah, I have just sort of more of a comment, I guess, or an area that I need a little better understanding. So, it's always been the case that or as long as I've known it, that the Board of Health has sort of two, separate functions. There's the land use part of it and, septics and, all of that. And then there's the public, and then there's the, what would you call it? The health services, flu clinics and being able to consult with somebody at town hall with, medical questions, et cetera. And so it's a little hard to separate out in the presentation, which are all those. I understand that the public health nurse at 10 hours a week would be doing those service deliveries to community members, but are all the other kind of land use functions, you're thinking that increasing the hours for the assistant to the health agent is going to provide you with the kind of skill level as well as the time to cover all of those other things that you're saying either have been neglected or have gotten more complex?
Maybe for one thing, I think there's a lot of overlap. Like I just mentioned the PFAS in well water. And that's the sort of thing that, either an assistant or a health agent or a public health nurse, any one of them might be able to work on that. But the other thing about the public health nurse is that traditionally they're very good at communication. So, if we're trying to get messages out to the community about, beavers or rabid rabies, or sort of drawing a blank on a good example here. But, you know, I think there's a lot of overlap, that even though things may be traditionally land use, that's not to say that a public health nurse wouldn't be working on it. Linda, you can jump in here. I think, you know, over the years, you've worked more closely with people that we've had on grants and things.
Yeah, I agree. So like the nursing, I mean, what I'm thinking of is triple E and West Nile virus, which has a lot to do with land management. You know, we are a host for these mosquitoes. And the public health nurse not only follows up on the disease, but she's vital in educating residents and educating, you know, how to prevent contracting these disease. Tick-borne disease is another good one, where there's overlap between the environment, the land use planning kind of thing, and the health system.
I think, you know, this all speaks to, we've been working to try to streamline and maybe consolidate in some way the land use boards. I'm not against, you know, putting more hours to all the things you guys have to do, but I'm very much against the Band-Aid style. And I feel like there's a real need here to clearly define position descriptions, who's responsible for what, not just within Board of Health, where you have now three things, right? Health agent, assistant health agent, public health nurse, and maybe there's an admin function baked in there too. And then, as you mentioned now, conservation, permitting with, you know, building. I'm not really, I've never been clear as to why the Title V stuff has to go through the Board of Health anyway. Like, why wouldn't it be more of a, you know, permitting thing?
It's a state requirement.
But it just seems like we're just diving deeper into this crazy quilt where there's not a clear delineation of, you know, who does what, where can we consolidate? We just went through, you know, this exercise that I thought was pretty successful, where we got the land use boards together and talked about common things. I read in your, you know, write up here about things that need to be done, that COVID, it was more complicated because people couldn't be face to face, and the documents and blah, blah, blah. And, you know, a lot of what we talked about was digitizing all that and making it easier to be online, not more difficult. And so, you know, maybe there's a short-term fix we have to pop in, but I'm really against just saying, okay, let's just add hours, you know, over time. I think that I would rather see that we really take a concerted effort to clarify who does what across all the boards, and, you know, what the appropriate, like, staffing level for each of those positions is.
I'd like to make a comment about the electronic records, because where I work, we went to electronic records, and it's very powerful. It's very beneficial. It takes more time.
Well, in the beginning, of course.
No, just, I'm talking about not just at the beginning. It takes time to get it started, but once you have the system running, you need the resources to maintain it, to back it up, to audit it, to make sure that your records are, you know, are adequate for if you have a lawsuit. And, you know,
Kathy, we're not reinventing the wheel here. I mean, everybody goes digital. And if we talk to, you know, John Matevier, or, you know, we've had this conversation, and we can't stick our head in the sand in the 20th century. We're in the 21st century. So yes, I agree that if we have to resource, and I think, you know, we on the select board side have been very clear now, we plan to resource the IT function. So we should do that. And I think we should embrace it and not make it, you know, a thing of obstacles, but rather, how are we going to do it? How are we going to do it more efficiently? You know, we should just do that, but that should be like a global, you know, town initiative.
I agree with that. It should be, yes.
Yeah, and that would suggest to me that, you know, along with what David's saying about sort of taking a broader view of what are the responsibilities under the different boards and where's their crossover, you know, the piece of that, you know, we haven't really fleshed out, but we really need to, is the kind of IT part of that and how that gets accomplished. And it may not be something that you need to add hours to a particular position. You know, that it can be done in a more centralized way. So anyway, I agree with David about sort of trying to, if we have to do something short term, that's fine, but yet to really take a much broader view of how those different departments are working and how we can make it run as, you know, efficiently and sort of productively as possible, rather than just isolate, you know, looking just at the Board of Health.
Could I speak to that?
Sure.
So I totally agree with where we're going as far as making, you know, streamlining the land use departments and the tasks and that type of thing. And I mean, as anyone knows that's on our small work group, we've been working pretty hard trying to figure this out, and we're making progress. But I don't want to confuse that with what we're asking for. That's different. It's related, but it's different. We need a health agent assistant with the proper training to be a health agent assistant to handle a lot of the tasks that need to be done. These aren't clerical tasks. They're not managerial and organizational tasks that the electronic management system is going to alleviate. These are things that can only be done by a trained health agent or assistant to the health agent. And there's no way to cross-utilize other people that haven't been properly trained for that. That's the gist of what we're looking for in this position. And you know, certainly Linda can elaborate on that if necessary.
Can I add to that? Because we seem to have missed the point of emergency preparedness. So the Board of Health really has three roles. It's, you know, disease in town, and it's also land use permitting, and it's emergency preparedness. And we need the hours as much for emergency preparedness as we do the land use permitting. I'd love to see some modified systems that are more efficient for the land use permitting, and I'm glad there's a group, you know, looking into that. But I am concerned about not having a fully trained assistant. I'll just tell you a quick story. 3 years ago, I was in Florida visiting my son, and the way the state tests you is they do drills to see how quickly you will respond to an emergency alert. The emergency alert came through. I'm in Florida, and luckily my part-time assistant was in the office, and I managed to walk her through the steps to respond, because the state actually times you. And this has to do with any potential funding source later. And as I'm doing it, we were successful. We responded within the time frame. And I remember thinking, this is ridiculous. What if it had been a real alert, not a drill? And so that's what we're also looking for, to have someone in my seat that could do whatever, whether it's land use, public health planning, or emergencies. And we've run a number of shelters in the last few years. It does happen.
But again, you know, we're a small, I don't disagree with any of those things, Linda, but we're a small town and we have a lot of overlap. I mean, we have a whole LEPC with other people that do things, right? Police, fire, etc. And I always get the impression like it seems insular, and I don't think that's the right approach. We're too small a town that if we balkanize every single function, every single department's going to say, well, I need more people because I can only be the one to do it. And again, short term, I agree with what Barney said. Short term, if we got to throw some hours at somebody to take care of things, let's do that. But that's deviating from what I personally believe is the longer term. If we're going to survive as a small town, let's just be, you know, I don't want to overblow this, but if we're going to survive as a small town, we've got to be nimble, cross-trained, flexible, because we cannot be a town of 5,000 and every single department has its own little special things and only they can do it. It'll just never work. You know, we'll get assumed by Concord eventually because scale won't make it happen. It'll be unaffordable. So I find it retroactive, that approach. And I really, you know, again, from my view, we've got to, it seems like it's moving more towards balkanization and away from the consolidation that I think was more of our, focus this year.
So David, could you just kind of explain how you envision that happening? I mean, would a member of, some other entity in town, one of the public safety entities or something, a fire department, police department employee or someone actually go to the training at the state level that's required for these, for the health agent or assistant health agent position to execute the duties that they need to do? So is that what you mean by the cross training?
Well, it's hard, Tony. It's hard for me, unless we have a position description. These are the things that need to be doing statutorily and functionally. It's hard for me to say that, but yes, I believe, and again, I'm operating from a much less knowledgeable position than you guys are, but it seems to me that we do have trained people in public safety and other functions. So when I hear emergency preparedness, I hear public safety. When I hear, septic, I understand that there's aspects that are Board of Health, but there's other aspects of permitting and testing and stuff that I think other people who are used to doing those things in other ways could probably manage, or at least co-manage. So I don't really know that answer, but I get the feeling that we're not proactively looking that way. And I'm saying it more globally, Tony. I don't mean to single out Board of Health. You just happen to come up with this request right now. If we take the position that only one person or one department can do a certain thing, we eventually will no longer be an independent town. We will be forced into, economies of scale will force us to merge with Concord in some function, because we don't have the scale to do it that way. We just don't. So, I mean, I'm looking, years, decades down the road. And I guess, I'd like to hear from Kate and from Luke on this, because I believe you have opinions on that.
Yeah, I mean, I agree with you, David, and Barney completely. I thought when we were sold the 24-hour position last year, that it was actually a more qualified individual. They were gonna be an assistant to the health agent.
I'm sorry, I can't understand you, Luke.
I'm having issues with my microphone, and IT won't fix it. Is it better? Is it better if I yell? Any
No.
better?
If you go in and out, Luke.
Yeah,
We heard the son of a bee part really clearly.
yeah. It better?
Yeah.
Yeah,
Okay.
but yeah, now you're frozen.
Okay, give me a minute because I'll kick onto the Wi-Fi. Well,
Tell your kids to get off the video games.
no, nobody's here. That's the joke of it. There we go. Now I'll go back hardwired. Is that better?
A little bit.
Okay. So when we were approached with a 24-hour position last year, I thought it was actually for a more qualified.
Luke, we
individual.
still can't really hear you.
Let's have Kate talk while you.
You want to call in, Luke?
Yeah,
Well,
I'll
try your-
call
yeah.
it.
Sometimes when you turn off the video, the audio works
Yeah,
better.
turn off the video. That's a
It
good-
hasn't in the past for Luke, so I think he's going to be forced to call in. Well, I am in agreement with David. I really was in support of your, in fact, I am still in support of your proposal last year of having a full-time employee rather than two part-timers, and to have the second, too deep and all those things. And I also am in agreement that there are extra things now due to COVID, but I'm not anxious at this point when we're still working on the master plan and we're looking at various other ways of possibly reorganizing or not, to kind of memorialize something, etch something in stone at this point in terms of operating budget. So I'm not opposed to a short-term help, but I'm not anxious to do long-term change at this point until we have had a chance to kind of survey the more global picture.
Well, what would you call short-term, Kate?
3 to 6 months, you know, it's hard to tell.
In fiscal year 22?
No, for the balance of this year, I think, right, Kate?
The balance of this year.
This
Well,
fiscal year.
we've already put, I mean, back in October, we put together our projections for COVID needs. And I actually thought John Fisher was going to talk about, budgeting for COVID, but that was my mistake. But we projected that months ago, and I don't think we've had much of a change in that strategy. But I think we have a problem. And you referred to a full-time position. Our assistant to the health agent is not a full-time position.
Well, a benefited
It
position.
is a benefited position. It's not full-time.
And so maybe, I thought maybe Luke was going in this direction when he started to talk. So the assistant to the health agent change that was made last year, are you saying that person has the certification and the training that we need to fill in or be able to cover for the health agent? Or are you saying that currently that position isn't filled by somebody who has the skills, the certification that we need for a, second in command?
Barney, I can answer that.
Yeah.
So the current assistant, what the state is trying to do in all states is standardize health departments. So everyone has the appropriate certifications for the jobs they're doing. And what Chris Gines, my assistant, has been doing is taking these courses online through the local public health institute. And each module covers Lyme disease, one covers shelters, one covers, it's the various things the health department is responsible for. She's been doing this on her own time. And I think she's done more modules than I have. She's probably more up to date than I am. A few things she was not able to do, like become a Title V inspector, because they're not giving the courses right now because of COVID. But that would be, that's what we're planning to do. And I just want to clarify one other thing. I have a concern about this interpretation of what public safety does. In each of those disciplines, it's very specific. Police don't go and put out fires. Firemen don't go and handle criminal activity. Neither one of them would probably step in and run a shelter. That's Board of Health. So within each of those public safety disciplines, there's specialized training. And definitely public health has a specialty, emergency response to communicable disease, outbreaks, that the other disciplines would not have. And so I just wanted to be clear, we're not talking about general public safety, but the public health portion of it.
And one other thing just around the assistant to the health agent is that when you talked, Tony, you had a piece in your PowerPoint about succession planning. Is that the position that you're viewing as the place to develop an individual to be able to take over as the health agent when the time comes?
Well, yeah, I mean, certainly when the time comes, there's nothing keeping us from looking out, in the public and trying to find a qualified health agent. But in the meantime of doing that, and in the planning toward it, this assistant position can cover a lot of things that need to be covered. And it's not just for succession, but for the times when the health agent is although she hasn't been doing it lately, able to take a vacation
Sure.
or sick or, unavailable. That's probably more important than succession planning, but that could be a piece of it. Yes.
Just so you're aware, when Linda goes on vacation, even pre-COVID, she is still doing health. She is still having to respond to public health related issues. So if something comes up when she's on vacation, she has her phone with her and she switches into non-vacation mode.
But what you're suggesting is that the assistant to the health agent position that we now have, that's now filled, that person could not cover in a situation, if such a situation should arise?
They could, yes. Linda, maybe you could comment.
It depends on the situation. Something might be so extreme that, it would be beyond her capabilities. That's where I'd be called in. But the assumption would be that, yes, for 90% of the so-called emergencies that pop up, she would be capable of doing that. And I'm even seeing that now, even with just the limited time that I've had a single assistant, the possibilities of really fine-tuning how the working relationship and when one takes over and one does the other job. And the other thing to point out is that 2 years ago, the Board of Health actually adopted a succession policy. And it's something that, gets looked at every year. And it was based on when we originally started thinking about a single full-time assistant, that the board came up with this succession policy, how it would work, how it would get evaluated from year to year, the kind of noticing, and I was pretty impressed.
Yeah.
Yeah, and I mean, a good example of that was the flu clinic where she stepped in while I think you were ill or something, and she did a marvelous job of filling in and really doing the job.
I think Luke is back with us.
Yeah, can folks hear me now?
Yay!
Hey, all right. Oh, geez. So I mean, I guess Barney, yeah, you really kind of touched on a lot of what I wanted to address, because I first off, a $35,000 ask is a significant ask. I mean, that's not, that's not a small amount of money, and and it's hard to compare boards, right? I mean, you can't compare one board to another. My question was, I thought when we were told back, a year ago, when this 24-hour position was being created, that was the goal, right? This assistant to the health agent would be able to do essentially everything that Linda currently does. And I mean, I know you just said in the past couple of minutes that essentially they can, but now the presentation you gave kind of alluded to the fact that they couldn't. And then, so I guess also too, when the two positions went away and the one position came, right, did you actually let the two people go and hire a new person? Because I thought we were getting a more qualified individual. Or is this somebody, and either way it's fine, right? But or is this somebody that, one of those two were promoted and now they're going through and doing these online trainings and doing that sort of thing?
The person that we hired was one of the part-time people, but she was way overqualified as far as degrees, a science background, a lot more relevant to the health department.
Mm-hmm. Okay.
Go ahead. Sorry, Luke.
No, the other piece, but it's just. I mean, I guess, just because somebody's got the right degrees and whatnot, if they don't have the experience in the area, right, it's just, it's kind of a big oops, if you ask me. I mean, we were sold this as, this is really the way to move forward. And, we had asked for the succession plan. I don't think anybody disagrees that an assistant health agent isn't needed. I definitely think there's more value there than a couple of admins, right? And, everybody wants to be able to take vacation and actually enjoy the vacation. But it seems like, we almost went kind of backwards here. And I don't think the fix is a $35,000 one. I think, it's maybe as Barney alluded to, throw some money at it short term. Also maybe get in some consultants. I mean, you don't really, I was on Conscom for years, and we reviewed the regs, but anytime there was a serious situation that nobody really understood, and we get a consultant. I mean, that's just what you do. And I don't know. It seems like, the alternative systems are not going away. They've been around for decades, a decade at least. I mean, we saw them when I was on Conscom 10 years ago. So, it seems like, and again, it's hard, right? We're all volunteers. We all do this part-time. And to ask some of the board members to actually review and try to figure out, exactly how a system works is it's going to be inefficient and it's going to be difficult. And you're not going to get that expertise that you could get from an outside consultant.
Let me just clarify. Let me just clarify that we have an engineer that reviews all of the plans. So, in terms.
Is that Rob?
Yes, that is Rob Fredo.
Yeah. So I mean, Rob's been around a while. Why? And I don't want to sound like I'm throwing Rob under the bus. I don't really know his skills or his qualifications, but why does it seem like every time there's an alternative system, there's confusion or there's.
Well, I don't think there's confusion, Luke. But for example, when the Benfield system failed, I mean, we had to bring in an independent reviewer, but at the same time, there's more data that's been built up. And so, for example, there's a county that has an extensive database of all of the IA systems in that county. And so, for example, for one of the systems, it turns out that more than 2/3 of them run out of compliance. And that's the sort of thing that you need time to find out. So, I think you're really going into the weeds. And, as far as your point that it was a big oops last year, that's not the case at all. We have definitely moved forward. There's been a lot of efficiency by having a higher level person. As Alan alluded, there have been times when the second person has filled the role of the acting health agent. She's, I forget her title, nutrition or dietitian. So, for example, when the ice cream stands needed to have their inspections, she was able to go and do that. So we've made a lot of progress, but I think that we're still learning about just the breadth and the depth of the work that falls in the health department.
I also want to add, we were told that we needed to keep level service. And so we restructured the two assistants we had to create that one position, not only for the training and the capability, but to keep the budget right and perform and still perform the work as best that it can be done. Now we're saying that philosophy was not an oops, that was the right way to go. It's just we don't have enough capacity, and the workload is much higher than we had anticipated at the time when this came around last year. And I mean, we could have pushed more last year, but we wanted to work and see what we could do and keep the level budget, and we were able to do that. I think the restructuring was the right approach. What we're looking for now is more capacity.
Our entire budget is 111,619. That is about the smallest budget in the town. And for when you look at the work that we're expected to do and the regulatory responsibilities we have, it's just not in line. I mean, you saw the slide, you saw recreation, you saw Council on Aging, you know, just vastly more amounts of money being put into that. We're serving every single person who lives in Carlisle, the people that work in Carlisle and the people that come and visit Carlisle. And this is just something that the town has to be committed to public health.
Yeah, we're not saying that the town isn't committed, but again, to compare budgets across departments, just isn't, you can't do that. You know, I mean, you guys came in with a proposal last year and you just decided to up your fees to, you know, from 1,000 or whatever it was to 1,500. I mean, they upped significantly. Right?
We did not just up them, Luke. We set them so
Can
that
I finish my sentence, please?
Yes,
Can I
you
finish
may.
my sentence, please? Conscom can't do that. They are restricted by the amount of money that they can actually charge for fees. You know, John Mativier, same sort of thing. He can change the fees accordingly, right? And essentially, when you can change your fees, so we have, how many properties in this town have wetlands? And I'm not just saying this because I was on Conscom. I just happen to know Conscom. You know, they deal with the vast majority of properties in town too, but they can't adjust the fees accordingly to help compensate. So the town is responsible for covering that gap.
We cannot, I'd like to clarify on the fees. I want to clarify this because we can't, this fees are not a profit center. They have to
They're
cover the services. And we have detailed spreadsheets on how long it takes. And so it is just a direct one-for-one charge.
So
Right, and if these new systems,
Yeah.
cost more money, if these new systems cost more money and it takes more time, then you can charge accordingly. You know, it's. My point isn't necessarily what your fees are. My point is that every budget is a little different. Every department is a little different. Just to say we get less than everybody else, you can't make that comparison. You know, all it sounds like is, well, they get more than we do. And
I'm not
you know,
saying that, Luke. I am saying that
but
when you
that's what it comes to process.
when you consider that we have to have too deep agent capability, and these are skilled positions and they have job descriptions that have been approved by the personnel board, to have two highly skilled full-time, you know, having full-time capability for agent capability, and to have a budget of under $112,000, it really just doesn't compute. To me, it does not compute.
Well, nobody disagrees.
I mean, what's more relevant is comparable towns, not relative budget research than we have on
David, it's hard to hear
What?
you. You're going in and out. now.
comparable towns.
Look, if I can redirect this a little bit, the reason to show that slide and compare those was to show the growth over time as the town developed. It wasn't really to compare the other you know, other departments in town, and I think it clearly showed that the health department budget has stayed fairly flat compared to most of the other departments in town. Not necessarily planning board, I think, was the other one that was close to Board of Health. But that was really the idea of that slide, to show that, not necessarily to compare, because you're right. I mean, how can you compare departments that do completely different things? But the rate of increase, I think, is important. I think it reflects the changes in town and the need to provide services as a department for the town. So.
Right, but what I was saying, I'm sorry that I cut out. Hopefully you can hear me now. What's relevant is comparable towns, not within a town, or even the growth within a town. So, like, Kate, you've done the most comparable research, I think. Do you have any comment on that?
I'm still in the middle of it, so I'd rather not comment on that. One of the things, though, I would like to comment on is that I'm concerned that we are conflating the two positions that this board is asking for. And we're talking about the assistant, and I would also not like to lose track of the public health nurse, which I personally am very much in favor of, because I think we need that function in town. We're losing what little function we had. And I agree. I don't think it should be dependent on grant money.
Yeah, and I agree. And I think I mean, Tony, so let's go. I'd like to get a copy of Tony's PowerPoint if we can, when we're done, Tony, because I think we need to partition out the things that our public health nurse do and the assistant do, and I'm not prepared to make a judgment tonight on what that is, but and I agree completely, Kate. I think, yeah, I mean, one of the things we do know is that the amount of contribution we get from the public health nurse that currently is partly provided by Concord is going to go away, and so we need to replace that, and there's no question about that. And I don't doubt that we probably need to do something with the assistant too, whether it's a full-time position or not, I don't know. But I would like to look at that list again and partition out where those relative duties are. And so if that's appropriate, I'd like to do that, and then we can address this further before the Board of Finance meets, before the Finance Committee meets.
I'll be glad to send that. Should I just send it to Tim and he can distribute it, or?
That'd be fine. Yes.
Okay.
Yep. That'll work.
One other point, though, to that same point, the package that Kathy sent to Tim for all of you in preparation of this meeting has even much more detailed position descriptions in it than the PowerPoint. So, the PowerPoint can be a general guide for you, but if you really have questions, dive into those, and that'll be very helpful, I think, to you.
Got
But
it.
Tony, if you're referring to what's in the packet, I
Right.
found that somewhat confusing compared with I actually thought your PowerPoint was pretty clear, but the packet seems to also refer backwards, like we have to repay some money for things that have already been done. The numbers weren't the same, I guess, and so I'm not really clear on what the ask is.
Maybe you're looking at some of the material that went out about fiscal year 21 and the whole COVID spending that's going to be going forward now that
Well, there's
CARES Act is going to end.
There's like 4 tables.
That's a different issue. So
What was that in the DocuSign packet?
No.
Oh, what? Okay, so I missed it altogether.
Here.
So there's a totally different packet of information that came to us?
Came much earlier.
What's 53 is not an ask, right? That's paid by fees.
Okay.
You should have had this memo in your packet.
Right.
Does this look familiar?
No.
No,
No.
no.
No,
So
No.
the PowerPoint, I think Linda actually sent it to Tim last Wednesday, and it must not have gotten in. But this is a 5-page description that the PowerPoint was actually developed from.
Well,
Okay.
that would probably be helpful to see.
Yep.
Okay, I'm sorry. We all thought that you had this. This was the main presentation for tonight, and this is what we thought you had in your packet.
No, we had a bunch of charts.
Yeah.
Okay, so that was the COVID projections that we thought John was going to go through.
that's a separate issue, and that's
Yeah.
another important issue because once CARES runs out,
Right.
we have no funding for all of this COVID spending
Yeah.
for fiscal year 21.
Well, the good news is that CARES probably isn't going to run out, at least not at the end of the year. It looks like it's been extended, and also things that are COVID related. The new stimulus package has money in there for that. Fortunately, if it can be, somehow tied to vaccine administration and testing, there's going to be money for that. So things aren't quite as bleak as they looked in terms of that. So I think we'll be okay there.
Yeah, have the feds issued any sort of documentation on that?
It's coming out in dribs and drabs, but
Yeah, yeah.
yeah.
Is anybody consolidating that? Just because it seems, like the information's coming in a bunch of different directions. We're spending money as is every town and municipality. Like it's growing on trees. And, my concern is just that at the end of the day, the money will stop and we'll still have debt. And then how do we cover all of that,
Yeah. Well, we're all concerned about that, and it doesn't look as bleak today as it did last week.
Yeah, no, last week it was scary. Yeah.
So hopefully,
Because,
but there'll be a recent, Priscilla and Bill Risso and people are looking at that, and I'm sure Tim, is very familiar with that. So those resubmissions will be made. And I think we'll be okay. I think we, covering the COVID related expenses probably is going to be able to be done. We at least it looks more favorable now than it did a week ago.
yeah,
So that looks good. Yeah.
Yep.
So are we, what I heard you say, Alan, I just want to confirm is that we're all going to take a closer look at the information about the Board of Health and needs and the description, what you provided or what's in that piece that we haven't seen yet. And then we're going to revisit the topic at our next select board meeting.
I think that's probably a good idea. If
I'd agree with that.
From what I'm hearing tonight, I think the board as a whole isn't prepared to say yes, we wholeheartedly support this proposal to go forward. But I think there are elements in it certainly that we do, and but we need to be clearer about what exactly we're going to recommend. If in fact the board of finance, I keep on the board of finance, the finance committee wants that prior to them making their own determination. Yeah. Usually it comes the other way around. But, yeah.
But how do we,
this is
from a
the right way to do it.
Alan, from a practical standpoint, how do we, because we're not meeting again till the 12th or something? I forget.
12th of January, yes. And they're not meeting till the end of January. I mean,
Right.
in terms of looking at anything for the budgets.
I mean, I guess my question is, should we have a smaller working group that dives in with the Board of Health on details and tries to sort of craft a compromise? It's very hard in this larger meeting to kind of get there.
Yeah, right. Yep.
So
it's
I'm
got to
willing
be
to volunteer. I'm a Board of Health liaison. I could volunteer.
Well, that might be good to do as the liaison. Again, this kind of has to be done in open meeting.
Well, we can set up a liaison, I guess.
The liaison can do it, yes.
Yeah, I guess.
Right.
I don't want to violate open meeting law. I just want to get something done. So I think, maybe, I don't know if Tony's the right person or Tony and Linda, but, one or two of us could meet with these guys and just kind of sort it out and then report it out on the 12th.
That'd be fine.
Yeah. So I'm volunteering myself. I don't know.
No, that's good. No, I think that's good. I can talk to you offline.
And who would be the other side? Tony and Kathy, or Tony and Linda, or what?
I'd certainly be willing to do that, but I would also urge you to read those documents, because they're really
certainly
thorough, and just so I think it would answer some questions before we, go
Oh
further.
yeah, no, of course.
Yeah.
As soon as they're provided, I shall read them.
Okay, Tim, do you still have those, or do you need us to resend that?
What I received was the justification for the increased continued COVID spending. What was just shown on the screen, I did not receive.
Okay, we'll make sure you
Okay.
get it.
That should have gotten to you. Linda sent that to you on the 16th at 3:13 p.m. So, but it's possible that it got lost or it didn't make it to you.
Yeah, no, I'll certainly forward it to the board. Thank you.
Yeah. Thank you very much.
Yes.
David, you'll follow up as liaison.
David, Kate and I will Kate and I will figure it out. We'll
Okay.
follow.
Thank you.
Karen and I will
Got
do
it.
that.
Alan,
Yes.
are you going to need anyone from Board of Health when Tim does his report, which includes the COVID?
I don't
We
think
could do it
so, but
now.
Or
Yeah,
maybe
we can-
should we just
Do
do
it
it now?
yeah, we can do it
Can
now
do it.
while you're still here.
And do it very, yeah.
Yeah.
We had intended to make a request to the board on behalf of the LEPC to continue the funding for the gatekeeper position and for the additional hours for the Board of Health assistant. Part of the legislation that was just passed extended the deadline for care spending from this December 30th or next Wednesday to December 31st, 2021. So in essence, we have another year to spend that money. And so the deadline is not, in fact, next week. And Priscilla assures me that there may be a time when we ask for additional funds, but it's more like May or June. And we certainly can continue to fund both of those positions currently. And we'll monitor that going forward, but we feel like we're in a good position to continue with that.
I would suggest that we, whether we want to discuss it or not, have a motion to do that, to continue to fund the health-related COVID expenditures.
Okay, I move we vote to support, to continue the COVID-related expenditures.
And is
Second.
is we doing this for a period of time?
Until the funds run out or until we're no longer
Yeah.
necessary.
I mean, I think we'll things like the
Review it.
gatekeeper a lot will depend on exactly how much, when that is going to be needed, which kind of be an LEPC decision, which health is well related. I mean, Linda's on that group as well. And so, but we just in the LEPC decided we want to keep that position, at least for the time being, because it was going to
Yeah.
go away next Wednesday.
Yeah, I would say the gatekeeper probably will go away before they help the extended hours to the health
The
department.
health nurse, yes, right.
To the health.
Yep.
Or should we say something, sort of at the discretion of the LEPC
Sure.
in terms of the length?
Yeah. Yeah.
Okay.
The duration of it?
Yeah, I'd hate to put an expiration date on it at the moment.
Yeah, that's what I'm saying. Until the money runs out, or December 31st of 2021.
Right. Well, but no, we may want to cut it off before that, but
No, not to
Yeah.
exceed.
yeah,
you
not
know.
to exceed, yes. Okay. Do I have a second?
Second,
Okay, any discussion? Hearing none, we'll do a roll call vote.
Arnold, I.
Oscar, aye.
Louis, I.
Modell, I.
Reed, aye.
Thank you. You got your money.
Some money, some of it.
Some money, yeah. All righty. Thank you all.
Well,
Yeah,
Thank
thank
you
you.
for your time.
for time
Have a
coming.
nice Christmas, you guys.
You too.
Yes.
Yep.
Yeah. Hope you can take a little break.
Yeah, right.
We'll see. With that curve going up, I don't know. Thanks.
Yeah, don't travel to take that break.
Take a break at home.
Yeah. All right. Select board execute Lowell Street easement documents.
And I'm going to recuse myself as one of the parties involved for this conversation.
Gotcha. All right. We did have that in the packet. We've looked at this before as well.
Yes.
Do I have a motion?
I move execution of the grant of easement on Lowell Street property.
Do I have a second?
Second.
Discussion?
I
Hearing
want-
none.
Two.
I would just like to thank the grantors. Very-
Yes, absolutely.
with great
There
appreciation.
actually there were two
There are
easements.
two easements, yes,
Yeah,
right.
the reciprocal. There's one from the town to them and one from them to us. So
Yeah, okay. You want me to, we can do this in one motion, though.
Yes,
Yeah,
Yeah,
you can.
okay.
Yeah, just reference both. Yeah.
right.
Okay.
Okay. Roll call vote.
Arnold,
So-
abstention.
Oscar, aye.
Louis, I.
Modell, I.
Reed, aye.
Thank you. Motion passes unanimously.
Okay, so the
One-
motion,
With one exception.
the motion for Jennifer's reference is the motion is written on the December 22nd, number 4, proposed motion.
Yes.
I didn't read the whole thing, but
All right, appointments. Animal inspector.
okay. I move to appoint Jean Delano, 1022 Westford Street, to serve as Town of Carlisle Animal Inspector to a term that will expire on June 30th, 2021.
Thank you. I have a motion and a second. Any discussion? Hearing none. Roll call vote.
Arnold, I.
Oscalillo, aye.
Louis, I.
Modell, I.
Reed, aye.
Thank you. Cemetery deeds.
No, we got another, there's another
Affordable housing.
appointment. I
Oh.
move to appoint Gina Fox at 252 Westford Street and Beverly Shorey at 200 Tophet Road to serve on Carlisle Affordable Housing Trust with terms that will expire on June 30th, 2021.
Second.
Any discussion?
I just want to say for those people who were at the meeting, I misread the housing trust. It's I was reading the state authorization for housing trusts, and it's they're supposed to have terms not to exceed 2 years. That's and I got confused, and I thought
Yeah.
telling you guys that they were 2-year terms. So I apologize for that. I went back and checked it. So these will be for 1 year.
Very good. Okay.
We need a
Hearing no further discussion. Roll call vote.
Arnold, I.
Oscalillo, aye.
Louis, I.
Modell, I.
read I.
Thank you. Town administrators report.
No, now
Oh,
the cemetery.
cemetery deeds.
Oh, now the cemetery deeds. I'm sorry. I already had a check mark there.
I got them on my thing. You want me to read? I move the Board of Selectmen vote to transfer land of the public burial ground to Alexandra J. Adrian at 106 Maple Street at Green Cemetery, Lot C41, Grave 4. And I also move that the Board of Selectmen vote to transfer land in the public burial ground to Mark H. Levitt and Gina Ziza at 105 Wolf Rock Road at Green Cemetery, Lot C93, Grave 1. And I move that the Board of Selectmen vote to transfer land in the public burial ground to Wolf Berroyer, I hope I'm pronouncing that correctly, of Carlisle, Mass. At Green Cemetery, Lot D203, graves 1, 2, 3, 4, 5, and 6. And one more. Shoot. I move that the Board of Selectmen vote to transfer land in the public burial ground to Kenneth and Martha Bedrosian, 44 Bedford Road at Green Cemetery, Lot D133, graves 1, 2, 3, and 4.
Thank you. Do I have a second?
Second.
Second.
Okay. Any
And-
discussion?
This is not all due to people contemplating their future with COVID.
No, hopefully not. Okay. Hearing no discussion, roll call vote.
Just, sorry, one minor technical thing is that the language just needs to be, say, select board, right, instead of Board of Selectmen.
Oh, sorry. I'm just reading this. Yeah, it never even occurred to me. Thank you.
Yeah.
Okay.
Yeah.
Arnold, I.
Oscalillo, aye.
Louis, I.
Modell, I.
Reed, I.
Thank you.
Taking some adjustment to get to this, the select board. I have to like mentally rehearse it every time I say it.
No, I do the same thing.
Eventually it'll happen.
Okay.
Now we can go to the town administrator's report.
Okay, thank you, Mr. Chairman. The first item is an update on the Personnel Board. The Personnel Board was scheduled to meet on December 3rd, but lacking a quorum. We're unable to meet and take any action, so exercising the authority that the Select Board granted to me, to take action on behalf of the Personnel Board. I approved a new job description and position grade for the Assistant Assessor, and also approved the Council on Aging's request for a temporary division of duties for the Retiring Outreach Program Coordinator. Regarding the Assistant Assessor position, you may recall that this was the one proposed wage adjustment that didn't make it to town meeting, but for the fact that the Personnel Board was unable to meet to approve the job description and the new grade. And they were unable to meet, over the past several months. So this one adjustment didn't go to town meeting in June. And it would have been a change from a grade 5 to a grade 6. It's about a $2,200 adjustment. I think in fairness, the board, should consider making it. The assessors, spent a great deal of time rewriting the job description to better reflect the duties and responsibilities of the assistant assessor. It's really not just a clerical position. It really is a true number 2 in the assessor's department. And I think that, that was pointed out, in fact, because the assistant assessor filled in for a 4-month period during an illness of the principal assessor and basically ran the department, for a 4-month period. Clearly was more than up to the task. And I think that, as I said, in fairness, this would have been one of the adjustments that we were talking about at town meeting, but for the pandemic and the fact that the Personnel Board did not meet to finalize the grade, the new grade for the new job description. So I asked if the board would consider that. I think it does reflect accurately the current duties and the skill set necessary for that position. I know some of you may have heard from the chairman of the assessors over the past several months as well. They, very much consider this to be an important position and important to the continuity of their department. And as I said, she did an admirable job filling in over the summer in that department.
So I'd like to move that we support the change of grade and salary for that position, and that we make it retroactive to June 30th, 2020.
Thank you. Do I have a second?
Second.
Second,
Further discussion? Hearing none. Roll call vote.
Arnold, I.
Oscar aye.
Louis, I.
Modell, aye.
Reed, aye.
Thank you.
Thank
Uh,
you.
Can I just very briefly, I know we're over time but Tim, what's your sense about the Personnel Board going forward? Do we need to do a shout out to identify some other people that might want to serve, or where?
I guess the follow-up to this is the Personnel Board was able to meet the following week, and they did take action on the COA's proposed reorganization, and they regraded 2 of the new positions and established the pay ranges for them. So they seem to be committed to getting back on a more regular schedule.
Okay.
There are 4 members. They need 1 more member. And I'm going to be talking at their next meeting with them about the proposed personnel bylaw and how that will change their role going forward. And they're open to that discussion. They're not,
Okay,
they don't see it as a threatening thing. They see it as a positive.
good.
Okay. Number 2, I think we already spoke to the fact that the CARES Act's not really going to expire next week. It's going to be a year from next week. So we've got some time to figure out how to continue funding the gatekeeper and the Board of Health hours. So that's good news. Number 3, as Kate had mentioned, I think at the last meeting, I asked town council about remote participation during the era of COVID. And the chairman, as we know, the chairman is required to announce which board members are participating in the call. And council's suggestion was that board members change their title, as some of you have done, to indicate to people that are on the call who's a board member and who isn't. I think virtually all of the other suggestions or more than suggestions are things that the board's already doing in terms of remote meetings. So I think it's, but for announcing who's on the call or changing your title, I think we're good with that. There's a thank you letter in the packet from the Timber Nook program. Thank you to the board for letting them use the Conant property for the fall programming. And then a list of our upcoming meetings. As you know, we've got the January 5th public information session on the cable licensing and cable issues. And then we've got 2 meetings scheduled in January. The meeting on the 12th will be a joint meeting with the Finance Committee. They'll be meeting on January 11th in preparation for that and in preparation for their budget sessions, which I think are the 25th and 27th of the month. And I think that's all I've got, Mr. Chairman.
Thank you very much.
Um,
Go ahead, Barney.
Yeah, just one thing about Timber Nook. Tim, so are they done for the winter and they're talking about resuming in the spring? Or where do things stand with their continuing?
Yeah, that's my understanding. I don't believe there's any winter programming contemplated.
Okay.
I-
I did get a question, and I just wanted to ask you in terms of follow-up that, and I walked back there myself just to take a look at it, that there's still quite a bit of equipment out. And the person that contacted me said that they felt like it was kind of a mess. Now, it didn't look all that messy to me, but it's the eye of the beholder. But I just wondered if it would make sense to be in touch with her to say, what is their plan around the equipment that's still out?
Sure.
Yeah,
I'll give Sherry a call on that and
that's great.
see if they can clean that up.
And the other is just on the upcoming meeting. So are we going to put the Board of Health request on for that, the joint meeting with FinCom? Will we have time to revisit the
no.
Board of Health?
Yeah, if you'd like to, the next
Well,
meeting
I'm
would be
just
the 12th.
thinking David had talked about trying to make that happen before the end of January when the FinCom is.
Well, we would have to meet separately and then report out what we concluded, I guess, right?
Right.
Present
Yeah,
that.
I was
Fine.
just trying to make sure we didn't forget about that, or, not
Yeah,
deal with it
I mean,
before
time
the-
is short. There's a lot to do, but I think, doesn't FinCom need to have a packet? Anyway, I mean,
The Board of Health has to send a presentation to them. Yes.
no, but I mean, we haven't, the ask is somewhat nebulous at this point. We didn't get the memo that they think we got, so we got to study that. We got to talk to them.
And
What else is on the FinCom? What's on the agenda with the FinCom? It's just general getting ready for town meeting.
Yeah.
Yep.
Yeah, I mean, the other thing with the Board of Health is the change between last year and this year. I mean, many of the things they're talking about were the justification for doing what they did last year.
Right, but what's the financial impact of that?
There isn't any.
That's the point.
We covered that last year.
Yeah.
So it's not relevant, right?
Well, it's relevant because it's part of the justification for the increase.
Oh, okay. Well, oh boy. All right. Well, I mean, it's one line item. You know what? If we can't reach resolution in that meeting, we'll have to have another meeting. So.
Well, and we don't have to give our opinion or our recommendation or not to the FinCom by the end of January. I mean, we'll have another opportunity, won't we, as a select board to?
Well, we don't have to give them our opinion at all. They tell us what they recommend and we accept it or we don't. I mean, it seemed to me that was backwards.
No, I know, but I mean, the point is that I think, yes, that's true, but it's a multi-step process. They should have enough information so that they can decide whether they support it or not, or if they have more questions.
Right.
And,
and that's part of they've requested that from all the town departments.
Right. No, exactly. So from a process standpoint, we should make sure that, we vetted that sufficiently, or it's vetted, not that we have, that it's vetted sufficiently so that reasonable people can make, decisions about it.
Yes.
So let's try to do that.
Yeah.
Well, the thing is though, because the CARES Act has been extended, they already had the extended hours for their assistant. So I mean, we can't extend their more hours than we've already extended her.
No,
Right, I
this,
mean,
but
that was the
no, this is for a
confusion.
permanent,
I understand.
what they brought today was for permanent budget changes to the fiscal
Right,
22
exactly.
budget.
I understand that, but what I'm saying is my justification for saying no is, we can do it another way. It will expire at the end of December, and then we can revisit it again once the workload has changed again, because now we don't have the COVID. And I just,
Well, except if you remember what he said at the beginning of his presentation,
Right.
this request is not COVID related.
well,
Right.
then they should be asking for even more hours, because they must have way too much to do.
Well, right. I mean, what I believe, I
don't
don't want to have, what I believe we should ask the Board of Health when we talk to them is, I want to see the position descriptions for the health agent, the assistant health agent, the public nurse.
Yeah.
And see if there's overlap and blah, blah, blah. And let's see if, I mean, we went from one health agent, suddenly we're going from one health agent to two. And I don't know other towns of 5,000 people have two
Hard to
health-
hear you,
You're
David.
breaking up, David.
They're breaking them.
Now he's frozen.
Get a little more clarity.
There he goes. Now you're back.
Now you're back.
David, we had a hard time hearing you.
It wasn't worth repeating.
Okay.
Hey, just out of curiosity, can folks hear me better
just-
now?
Yes.
Random
Okay.
musings of David Modell.
You are fixed, Luke.
Good. Yeah, well, I got a mic. I got a top
There you go.
mic now. Yeah.
Okay,
All right.
all right.
Liaison reports.
I have
Well-
one.
Go ahead.
So on the DPW and the stickers.
Oh.
So I had been in conversation with really Jen and Tim, I don't know, 2-3 weeks ago about whether we could have an online system for purchasing a transfer station sticker, particularly since, well, one, the drive behind this, the momentum for this is that the DPW recycling fund money, that's the transfer the sticker money is really low, because we basically haven't been collecting the sticker fee, for the last 6 months. And so we would need to get that back up and started. And also because it runs on a calendar year, not a fiscal year, January 1 is when residents are expected to start getting their new stickers onto their cars. And also I know that, and the police department would really like to not have the foot traffic coming in and out of the police station. So anyway, Jen did some research, and we, the town has a system already in place that we've paid for. That's a Unipay system that, for instance, John Matevier uses for his building permits that are all done online. And Kim Kane is the one that sort of is in charge of that. And she thinks it makes sense to set up a separate account within that same Unipay company that would be the DPW account. And so that would allow us to have an online application for a residential sticker. We're talking about just starting off with the residential sticker as an online, for an online payment, and see how it goes, sort of try it out in January and see how it goes before we try to go to the the construction and debris permits, or contractor permits for larger loads. The each new account costs us $1,700, the initial charge for adding the new account. And that'll come out of the DPW sticker fund. And then each subsequent year, there is basically an administrative fee of somewhere between $700 and $800 per account. So that'll be an additional cost in the DPW budget going forward. The way of doing this online, it'll mean that you go in and it'll be on the town website under the transfer station, and you would fill out a short application, and you can pay by credit card or by direct deposit, direct debit from your bank. In either case, the service charge is only 25 cents. So we confirm that it's very modest. The process would then be that after the person has filled it out online and provided their payment, the police department would verify their license number as being a resident in Carlisle. And then that could all be done online by Kirk over at the police station. And then Jen would get that information, and she would then issue the sticker itself and mail it out to the resident. And so we would have the expense of postage and envelopes. So what I'm suggesting that Gary and Jen and I discussed this morning actually and thought was reasonable is that we would, the sticker fee costs $25. There would be a 25-cent service charge that Unipay charges, and then we would add a administrative fee of $1 that would basically over the course of the year cover that $1,700 cost of setting up this new account, and then help defray the future fee if we think that's reasonable. So that means that somebody would be paying $26.25 for their $25 sticker if they do it online. And then we really want to drive people to doing it online as much as possible. That allows us also to create a database that this first year, it's going to take a little more time because you're building the database of all the people in town that are getting a sticker. But then in future years, it'll be very simple to just see if the person's in there from the previous year, and you just issue them the sticker. And so let me just think what else. So we would publicize it, put it out through the mosquito, and then also put it on the website that we're trying it out in January, that that residents do not have to, they can still continue to use their old 2020 sticker to use the transfer station in January and February. So you don't have to worry, right, about kind of making sure you get it done the very first day that it's available, because hopefully we'll spread it out a little bit, the online requests. And then because there will be some people that either don't use, that just don't use electronic methods of payment, or just prefer to come in with their check, that Jen will take those people, will let her know, and she will arrange for them to be able to get their sticker when they walk in with their check. We're trying very hard not to have it go through the town clerk for now, just till we get this set up. And also I know that is some concern about the additional time it might take from somebody in the town clerk's area. So and also because we can't, we don't want them to get, we need to keep separated the dog licenses and that income stream from the transfer station.
Yep.
Too. So that's what we're proposing. And I'm just double checking my notes to see if there's anything else in there. No. Just wanted to get your input, see if anybody has any concerns or things we haven't thought about. Excuse me.
Did you guys give any consideration to raising the sticker fee?
I was gonna ask the same
Yeah,
thing.
right.
The best deal in
Yeah.
town. Yeah.
Yeah, no, it is. I mean, it is such an antiquated stick, especially since we don't have pay as you throw.
Yeah. Is that something we can do?
Yes.
Yeah,
Why don't we do it?
just
Well,
unilaterally.
Okay, we're, this, people will care about this.
Oh, yeah.
That's all right. Let them care about it.
Because, a lot of people already, well, not a lot, but as Gary said, he gets complaints regularly from.
This is the best deal in the
Yeah.
county.
Hang on, I got it. My dog is growling at me because she wants to go out. So hang on.
Oh, I thought she was objecting to the fee increase.
I was hearing moaning.
I
and
su-
I
I
was
su-
trying to think.
I thought it was somebody's stomach.
I support the fee increase, but I have to say, going back to my many years in FinCom, this argument gets raised all the time, and the counter argument is it's really a tax, and we already pay a lot of property tax, so actually trash, at the transfer station should be included in your property tax bill. I'm just saying
That's
that's an
exactly what
argument.
Gary
that's
said.
all the time.
Yeah, in most, yeah, well, some places it is, other places it's not. Yeah.
I mean, really,
Yeah.
if Luna Zamaro or whatever her name was is here, she'd say,
Lana
why don't we
Zamaro.
pay go?
Yeah.
Why don't we just go to PayGo and force people to, think
Well,
about.
that may be next. Yeah.
Well, no, maybe we need to fish or cut bait. Maybe in certain respects, instead of raising the sticker fee, eliminate the sticker fee and just do pay as you throw.
Because we've
Yeah.
only got a couple weeks.
Well, and I think honestly, on the pay as you throw, while we could just institute it, I think because it's been brought up before and there's been, there's definitely been people that feel strongly that they don't want that here, that we would need to go through a longer process and have some input from the
And there's-
community. And so,
There's a lot of elements to that too, in terms of what do you do with big items and all that kind of stuff. So you have to have a whole well-developed
yeah, you have
plan.
to think it through, right, right.
So if you,
Being provocative.
if you're playing, well, no, but if you're playing chess, you'd say, well, all right, let's raise it to 50. Let's make the pain of the flat fee high enough that people are more open to pay as you
Well,
throw.
There you
Yes.
go. That's another.
You're diabolical, David.
I'm all for that. I gotta tell you, Rockport used to have $135 transfer station fee before they went to pay as you throw. $135.
Who did?
Rockport.
Ah,
They're rich over
Yeah.
there.
No,
That's
I
because of all the people who in Carlisle who live there.
That's right. I used to flip on my stuff from one house to the other because I was goddamn and go to hell before I paid $135.
So are you saying, Carl, you subsidized your Rockport residents by bringing your Rockport trash to Carlisle? Where's the mosquito? Maryland, did you get that?
oh, boy.
Oh, boy.
All right.
So are you,
Late and I'm getting punchy and I
yeah, are we seriously wanting to entertain a raise in the fee?
I propose we raise it to $30.
Yeah,
That includes the $1.25.
It doesn't include.
Doesn't include the 25 cents because that gets directly paid to Unipay.
Okay,
Yeah.
but it would include the $1,
Right.
so it would be $30.25.
Yes.
Yep.
yeah, and then for the second sticker, are we gonna
Well,
have,
that's still at 10,
yeah, so should we
bump
increase
that
that
to
too?
15. There are some people, I couldn't believe this, but Gary said he knows of at least a couple that have like 4 stickers.
Well, they're
Really?
the good guys. You know what? I
Yeah,
have
the
to
ones I
say-
know move the sticker from car to car. Yeah.
Right.
Yeah, I just, if I happen to take another car, and Mary Lynn can record this too if she's really. if on the odd on the odd day that I can't take my primary wagon, I just move the sticker. So the guys who get multiples are really being good guys.
Yeah.
They are
Yeah,
being,
yeah.
absolutely.
What-
Leave the second at 10 because that's going to go in the
Mary
same
Lou
envelope. It's going to go,
Stacy.
there's no additional time or cost to that.
Right. And
Right.
I agree.
Okay,
That's a good point. Yeah.
so why don't I put this in the form of a motion? I do think we need to vote on this.
Yes.
Absolutely.
So I make a motion that the select board approve a new sticker fee for the transfer station of $30.25.
No, the 25 cents gets paid to
Oh,
Unipay.
that off. Okay, of $30 for the first residential sticker for a residence, and that additional stickers for residents would remain at $10 per additional vehicle.
Thank you. Do I have a second?
Second?
Further discussion? Hearing none, roll call vote.
Arnold, I.
Oskalilo, aye.
Lewis, I.
L'Oreal, aye.
Reed, I.
Yay. By the way, this is exactly the same thing we do when we pay our property taxes.
Woo-hoo.
Yes,
Exactly the same
Exactly.
process. Yeah.
yep,
Yes. yeah.
exactly.
And it used to be when, before they changed the tax code, it would have been advantageous to pay it in your taxes. But now, since you cannot deduct your taxes and Uncle Sam isn't helping you pay for these fees, if it ever goes back, I would say, yeah, I would be willing to raise taxes. But otherwise, I'd rather have fees and the people that use the service pay for it.
Okay.
All right.
Thank you. Any other liaison reports? Go ahead, Luke.
Sorry, just real quick that actually, Tim, I meant to email Jen. Did she send out the CPA applications? Do you know?
I believe that she did.
Okay, yeah, I'm not on that list anymore. I'm not a chair of anything that gets them. So, yeah, so CPA applications went out. The application deadline is going to be the end of January. Reason we used to have it earlier in January is because we used to have a hard time scheduling meetings, but now with Zoom, you can be wherever. So it's actually, so we gave people a little more time, but.
Okay, well, I didn't get one as chair of the trust. Did you? You should have gotten one then as our representative, or maybe Maureen. I mean.
Well, I have one. I was
good.
the one that sent it to Jen.
All right.
Yeah, and actually the other thing that we've been meeting on is the Highland, the Highland Committee. And so we've had a couple of meetings, and it's a good group, really focused on trying to figure out a solution. One of the things that was brought up is budget, right? And I didn't really have an answer because
Zero.
What's that?
Budget.
Zero, yeah, exactly. Because really the charter of the committee is to find a solution, right? And
Yeah.
not necessarily think of budget, but obviously we are thinking of budget. So I guess with just a little more direction, we don't necessarily have to have this discussion today. It can be at the next Board of Selectmen meeting. Excuse me. Because what's happening is, different ideas are floating out there. Some of the ones that we've seen in the past, but obviously if the financial cost is going to be, prohibitive, right? Just say $5, $6, $7 million, right? That's probably a non-starter for this board. And then it'll never get through town.
$500,000. We have got to fix our other buildings that we're actually using, and we don't have any money for that. I wouldn't be able to support putting money into Highland before I put money elsewhere.
Yeah, no, and I don't necessarily disagree with it, but then it's kind of a pointless committee, right? I mean, it's
no, the committee is to make a recommendation.
Yeah, right, but it's to make a recommendation. But if we never have an idea of what sort of I guess, budget or
Right, or cost, potential
cost, right?
cost.
Yeah.
No,
Because
if they can make a recommendation and justify the cost, then that's fine. I mean, they've got to
but
come
there's
back and say,
never
here's
gonna
here's what
be,
we want to here's what we want to do with the building, and here's what we think is worth doing. You know, here's what it's worth.
but there needs to be, you know, we've, we've trod this ground so many times before. And because of, you know, the cost of bringing it up to ADA and everything else, the school and just all these parking, oh, there's all these issues. I agree with Kate, it's never gonna pass muster when we open it up to town meeting. So I guess my recommendation, Luke, is that in addition to whatever you do recommend, you should probably identify the fallback strategy, which is either raise it, what does that cost, or
400 grand.
otherwise mothball it. Because
Us
just
for-
to say no to every time you bring up you're gonna bring up a recommendation, and some people are gonna support it, and most people are gonna say no. So
Right.
we're gonna be back to
Yep.
where we started.
Right.
What's the alternative? I mean, should we really think outside the box? We love our old building, but you know what? If we raise it, what does that do to the land area? Does that help the school? Does it give them a bigger playground? I mean, what could we do useful that's not a building, you know, and what does that cost? I mean, that has to be like a plan B on the thing, I think.
That's not really in the
No,
building
yeah.
itself is though, you know, it really, you know, people are floating around a lot of different things, but one of the things that that Brian's proposed is actually making it affordable housing for members of the volunteer fire department. And you know, that's got a little bit of traction, but you know, it's just one of the many ideas that are out there.
Listen, Luke, I don't want to throw cold water on this stuff, but I spent many years in the school committee. It's right by the school. And
Well, Chris-
you cannot determine, it's owned by the school. You can't determine who's going to come in and out once you make it an apartment. You can't
No,
control that. You don't know, you have no control. You can't have it. I'm just telling you, that will be a non-starter.
So then how is it that, because this came up actually at, and you may know this and maybe it's a larger discussion, but, or actually if you could just direct me to the right person. So like schools in the city, they're right next to apartment buildings. You know, so how is that different than Carlisle? Yeah,
they've
because
got a fence.
The apartment building is not owned by the school, I don't think.
no, but Highland isn't either.
No,
They
it
own
is. I
land.
think
No,
it is.
you own the
I
land.
think the land, you should research that, but my understanding was the land is owned by school.
The land surrounding the building is the school, and then the building itself is now the Board of Selectmen, because I think when you were on it, you punted it to us. But like these are questions we're still trying to figure out, because if you know there was, well, what if we quarried people, and because the other piece too is if it can only be used, you know, after school or before school or on weekends, you know, then it severely limits what you know, what you can do with that, and it either becomes a school asset or not, right? You know, because if you're going to have different activities in there and you have to limit the time, right, then you know you limit the time that you can bill, you limit the
I would say, I mean, I guess I would approach it, you know, fairly simply, which is to say, number one, what is the base cost of anything to bring it to ADA and all that stuff, like elevator, blah, blah, blah. If that itself is so prohibitive, to Kate's point, that it's going to suck the air out of a public safety building or something else we want to do, we just should not pursue it.
Yeah.
No matter what the use. Number two, I think you should have a conversation with the school board.
Yep.
And ask those questions. I mean, it's a different school board now. I think.
Yeah.
You know, in the McMorrow Modell era, we were just against it, you know. 'cause
well, Melissa's on the committee too, actually.
Well, so maybe she's for it now. I mean, I don't know.
Well,
Yeah, no,
can I ask- I have a basic question, so I don't quite understand. So the school owns the land, and is the worry that the school has about having, you know, sort of non-school employees in a building right next to the school, is it liability? So that if something happened to a
No.
child as a result of somebody that was living in that building, or because
I think it's less.
homeowners
I
right
can only
across the
speak-
street and the school doesn't get to, query or check who buys a house across the street from the school. I mean, what's the
Yeah,
difference?
no, it's a fair point, and I don't know the answer. I'll just give you my own impression, which is, we live in a dangerous, we live in a beautiful little bubble town inside a dangerous world. We like an open campus. We like to think that our children can basically go play in the playground, go to the castle, do all these
Right.
things without, worrying, right? Now, we don't live in Boston. It's just a different dynamic. And, I know I get tattooed in the press periodically for saying that we're elitist and blah, blah, blah. But the point is, people have made a conscious decision to live in this little bubble, and we work very hard to make it safe and, where we don't have to worry about our kids running around. It's like a rare pleasure in this era. So how much do we want to load the deck? And the thing is, if you have a health club in there, which is one of the purposes a long time ago, or an arts center, you can pretty much patrol who comes in and when they go and blah, blah, blah. But the minute you start with an apartment, that's their apartment. You can't tell people they can't have visitors and that the visitors have to be screened. And then you just don't know. You don't know who's there. You don't know who's going out to the playground right out the door. It's just adding, it's not that any single thing is bad. And I don't think, Barney, it's about liability. At least from my view, it's not about liability like a court case. It's just, are we tilting in towards a potentially unsafe situation, and why are we doing that?
Well, listen, this is a discussion for the Highland Committee, not the Board
Yeah.
of Selectmen at this point.
right.
So
Yeah, no, but I just wanted to get some feedback from.
Well, I'm giving you.
I understand. Yep.
Because, yeah, we're kind
Yeah.
of standing on it, so.
Yeah.
Thank you.
Okay. I mean, I'm happy, Luke, I'm happy to be invited to a Highland meeting to pontificate about my.
I don't know if we want to invite you. But the thing is, so we do have Melissa and Christine Lear is on it as
So
well.
you have enough people. You're getting enough
Yeah.
input.
Yeah,
And,
you got
and
it.
if those people are in favor of it, it's fine. I'm fine with that. I'm just saying that that's only one piece of a total economic puzzle that at some juncture we run into the Kate theory, which is, what are you doing? We need to save our millions for a real building that we really can use, like a public safety building, not some fantasy about saving a 19th century building. We really ought to say, okay, if we don't do anything, what are our alternatives?
That's why we set up a committee.
Yeah, which, by the way, the 19th century building, which I would only put firemen in because of the way it was constructed, and it's
All right. I have a liaison report. The Council on Aging had a wonderful going away celebration for Angela Smith. There were 2.5 hours of nonstop cars driving by her, wishing her well. They had a throne. They had all kinds of good stuff there. She was absolutely thrilled, and it was done very, very well. It was very nice. Ferns gave us cookies and cocoa, and it was great. So
Yes.
it was very well done. Yeah. All righty. Approval of minutes and warrants.
Excuse me, I have just one
Oh, go ahead.
very short thing, but I know she's on the line, so she can add this to the minutes, but I just want to say that all of our thank you letters were completed today by the middle of the day and distributed. And as you saw, we'd already gotten a nice thank you from Joan at the COA. And I want to particularly thank Jen Gibbons, who really was the backbone for making sure that happened. And there was a lot involved in getting lists and getting the letters run off and getting them sorted by department, and now at the end getting the gift cards put into them. So I just want to express our appreciation, Jen.
That's great.
Here, here. Yeah,
So
absolutely.
helpful. Thank you very much.
who signed Jen's, because I want to be sure she got one.
I think maybe Alan had those.
I-
Can't remember.
Yep.
Because that would be a, heck of a
Yep.
note.
That's right.
Tim,
If she's smart, she put 2 in her envelope.
there you go.
Nobody else got one. It was just Jen. Yeah.
Right. Yeah, nobody will want, right. Tim, if you were missing one in your envelope, who to go to?
Okay.
All righty. Warrants.
Oh, let me get this up. We just need to, yeah.
To
Barney,
approve
just
the
gonna give
minutes
us
and
the
then-
report?
There are no minutes, so.
No minutes.
Oh, okay. Well, you can see it there in the packet.
Yep.
Do we need, you know what, we've been doing this week after week and I keep on forgetting how we're supposed to handle it.
Yeah, I think it's just a report, right? We don't have to vote to approve
We
it.
don't have to.
No.
Right.
Just a
Right.
report,
Right, Tim?
correct.
Yeah,
Yep.
okay.
Okay,
Okay,
Thank
just
you,
to accept,
Barney.
accept the report.
okay. Sounds good.
All right. Any further business? Hearing none, I would accept a motion to adjourn.
So moved.
Second,
Roll call vote.
Arnold, I.
Oscar Lilloye.
Lewis, I.
Model I.
Be die.
Thank you all.
David,
Happy Christmas.
Have a great holiday.
Happy holidays. Yes,
Yeah.
have a Merry Christmas.
Yeah,
Yep.
happy holidays, everybody.
Yeah.
Yeah.
David, I'll let you
Yeah.
take the lead on the BOH and you'll let me know when you schedule it.
Why don't, yeah, you and I let's have a call.
Okay.
After
Well,
Christmas. I'll try to remember to do that.
You
All
call me.
right.